The process of labor and vaginal birth is a complex and remarkable event that marks the end of pregnancy and the beginning of motherhood. The stages of labor are divided into 3 parts: Stage 1, Stage 2, and Stage 3. Each stage has its own unique characteristics and milestones that must be achieved for a successful vaginal birth. Stage 1 of labor is the longest stage and typically lasts from 12 to 19 hours. During this stage, the baby descends lower into the pelvis, and the cervix begins to efface and dilate. Contractions become stronger and more regular, occurring every 5 to 20 minutes. The mother may experience persistent lower back pain and cramping, and the mucus plug at the opening of the cervix may fall out, which is seen as a brownish or reddish discharge. The water may also break during this stage, which could be in the form of a large gush of fluid or a trickle. If any of these complaints are experienced, the patient must be transferred to the labor room. Stage 2 of labor lasts from 20 minutes to 2 hours. During this stage, the cervix is fully dilated to about 10 centimeters, and the baby's head moves beyond the cervical opening into the birth canal. The mother is encouraged to push during contractions and rest in between them. In a normal delivery, the head rotates to face the mother's back. During active labor, the uterus is divided into an active segment, which contracts to push the baby downwards, and a passive segment, which relaxes and stretches to create space for the baby to pass through. The appearance of the baby's head is known as crowning. An episiotomy may be performed at this stage, which is an incision in the midline or medial lateral to it, to increase the vaginal opening for the delivery of the baby. With the mother pushing during contractions, the baby's head elongates during its passage through the birth canal. This elongation of the head will eventually resolve a few days after birth, with the skull bones shifting back to their original positions. After the baby's head exits the birth canal, the head and shoulders begin to rotate to help the shoulders pass through the birth canal. The baby's shoulders are delivered one after the other in order to fit through the mother's pelvis. Once the shoulders emerge through the birth canal, the rest of the baby slides out easily. After the baby is born, the umbilical cord is then cut by the doctor or midwife. Stage 3 of labor is the final stage of normal labor, during which mild contractions push the placenta out of the uterus. Mother and child bonding is also encouraged during this stage through skin contact and breastfeeding.